Hello, I'm Susan Cole.
And I'm Matthew Hodson.
And welcome to aidsmapCHAT, our live show bringing you news about HIV for people all around the globe.
And this week we are celebrating NAM aidsmap's 35th anniversary. Can you believe it? We've been going for 35 years and we've got a brilliant lineup of guests to bring on later on. We have one of my dear friends. I call him the U=U Warrior King. He's Bruce Richman. He's from the Prevention Access Campaign in the United States and all around the world. And he's the person who's been spreading the message that undetectable equals untransmittable. But not only that, we've also got a young HIV activist and advocate. She's one of our emerging voices at NAM aidsmap. It's Mercy Shibemba. And my colleague, Gus Cairns. He's a legendary HIV activist, and it's his birthday today. So I can't wait to wish him a happy birthday live on air.
Happy birthday to Gus. But Matthew, this week, wherever I go, people are asking me, not about me, but about you and the fact that you've been in hospital recently. Can you tell our viewers how you are and how things have been?
Well, I'm okay. So it was a couple of days after the last aidsmapCHAT we recorded, and I wasn't feeling great. So I rang up in the UK, we have a helpline you can call up, and they said, yeah, you need to go to A&E. So I went to the nearest hospital and had some tests done, and they were like, okay, you need to be admitted and you're going to be here for at least a couple of nights. So with all of that going on in my head, and I thought, oh, I don't have my HIV medication. I need to get that. So I had someone bring that to me the next morning. And throughout all of the triage and talking to the consultant and talking to the surgeon and all of that, I had said, oh, I'm living with HIV. I'm on my HIV meds. I'm virally suppressed to undetectable levels and all of that. I kept on saying it. And when my HIV meds arrived, because I was hooked up to various drips and machines that go bing and all of that stuff. So I couldn't actually move. And so I had to call a nurse and said, oh, I need some water so I can take my these meds. And she's like, well, what are they for? And they're like, well, they're my HIV meds. And she's like, are you sure you can take them? I was like, absolutely positive. I need to take these. And so I was having this kind of argument with this nurse. I mean, and she was, obviously she was incredibly well-meaning. She wanted to make sure there wasn't going to be any interactions with the drugs which they were putting me on and all of that. But I thought, I'm so lucky because I'm so open about living with HIV that, I'm absolutely fine to just sit here in my hospital bed demanding that they give me water so I can take my HIV medication. I don't feel any shame or any embarrassment about that. But how difficult would it be if you were in that situation and you weren't as blatant about your HIV status as I am? So, I mean, I guess there's two things that could come out of that. I mean, one, obviously, it was just an error, and it's really important that in hospitals and in any medical care, notes are shared in a way which is appropriate so that you don't have to have those arguments. But also, it just, again, illustrates how important it is that we tackle HIV stigma, because HIV stigma is creating barriers to people being able to take their medicine as directed, and that's absolutely vital for our HIV treatment and prevention.
Absolutely.
But anyway,
well, you're looking wonderful anyway.
Well,
talking about looking wonderful, shall we bring on our first guest who always looks wonderful?
No pressure, Bruce. Oh my God, there you go.
And there. Hello,
how are you, Bruce?
So nice to see you both. Good, I'm great, and happy anniversary to aidsmap and to both of you. I mean, I'm glad you're out of that situation, Matthew. I was just listening; that sounded horrible, and another reason why we should keep doing this show. Great motivation. How are you both?
We're great. Now you're looking dazzling as always, but so it's kind of because you're the U=U Warrior King, as I always describe you, mainly because it makes you embarrassed. But how was it for you when you first found out that HIV treatment actually meant that you were no longer a risk of passing HIV on to your sexual partners?
Oh, how was that for me? Wow. I mean, it was mind blowing, because at that very moment, I thought that I probably had just passed on or infected someone with HIV. And so my doctor told me there's no chance, it's impossible that you could. This was 2012, and I just was, this is amazing. You mean I can have sex now without being worried and anxious, and I can love someone and not feel that I could possibly pass on this, the world's most stigmatized disease. And yeah, I was just, it just opened up all these possibilities. But then I was pissed off. I was really angry because nobody was saying this. It was 2012. There was a Swiss statement that I ended up finding online, and then HPTN-052 was science breakthrough of 2011, but it wasn't being shared, and people were not saying it. And so that's when I became kind of outraged that it wasn't being shared, and I knew I had to do something about it. And actually, fortunately, I talked to one of our guests tonight about it, or today about it, Gus Cairns, really early on. And he said it was the big secret in the field. Those were his words. And then went on to help us develop the U equals U, actually brainstormed the U equals U on a napkin at Croy. So I love that you have Gus on here as well to celebrate your anniversary. And
it feels very fitting to have you both on the same show.
Yeah. Absolutely. And Bruce, the U equals U message is so important all around the world. What's been your experience of sharing it globally?
Oh my God. Okay. Globally, it's been amazing. I mean, it's just been amazing. Like, I just came back from Dubai, and heard from the people from Oman Ministry of Health and from Saudi and Bahrain about how they have U equals U programs, and how it's actually, even in Oman, it's changing discriminatory practices already. People in Oman who have HIV were denied marriage licenses. And now it's a huge incremental step. We need to go further, but people who have undetectable viral loads now can, after a year, can get married in Oman. So we're seeing these progress even in places where, discrimination is the worst in the world, and so it's just so exciting to see H equals H. This is very, poignant, bittersweet now, and actually quite tragic. The Ukrainian government has an H equals H program. And just a week before Russia invaded, I was on at a conference with the government of Ukraine, speaking about their H equals H program, and representatives from Russian nonprofit organizations talking about their H equals H program. It's in China. It's changing lives everywhere. Everywhere people with HIV exist, it's changing lives. And the next part that's so exciting is it's as exciting to me as back in August of 2016, is now we can really use this in our advocacy for anything that keeps us healthy as people with HIV, because whatever keeps us healthy and enables us to get undetectable, not only enables us to live and thrive, but also means we can't pass on HIV, which is the foundation of ending the epidemic. So it's this win-win in our advocacy. Anything that keeps us healthy is now good for everybody. So when we approach our policymakers or other people who have these influences around the world about things that can improve our lives, now we can approach that from a win-win. It's not just about us, and that should be enough, that it's just about improving our lives and healthcare is a human right. But now we can also say it's about us and it's about you. It's about everyone. It's Ubuntu. It's this beautiful win-win.
I mean, I first heard about U equals U, or the concept behind it, from Gus as well. And I remember I was at a conference and just like kind of sitting down with him and saying, what you mean that actually it's safer to have sex with someone who's living with HIV and is on treatment and virally suppressed than it is to have sex with someone whose HIV status you didn't know? And it was like, mind blown. I mean, it was just such a kind of revelation for me. And I think for me, it has become something which is very central to what NAM is doing, because we're all about the information, we're all about the science. How important do you think it is to have that kind of scientific backbone to the message?
Oh, I mean, it's the reason we absolutely needed the science. We still need the science. We needed to, first the movement, as you know, because you were there in the very beginning, pushing to confirm, get these big establishments to confirm the science. That was the first goal. The first goal of this movement is first, build a global consensus to confirm U equals U. And you can remember that's what we started doing in 2016 and pushing the CDC and the World Health Organization and UNAIDS because once we had that credibility, and that was our first goal, firmly established that, you can go to the WHO website now, or NIH, or aidsmap, British HIV Association. I could keep going on, and it's confirmed. So we absolutely had to have that first, and aidsmap has been the huge driver behind that. Once you have that, then it's about communicating it. Once we know it's true, it's unequivocally true, we have the backing of the global medical and scientific establishment. Now it's about communicating it. So that piece is critical, and we have to keep getting that science out, keep showing people that it's true, because most people in the world don't know yet. And most people in the world will assume that we're all still, dangerous and should be feared, and we are the problem. And the framing it and backing it with science is so important. Framing us as actually, the safest people to have sex with, actually, and we're part of this wonderful solution of when we're healthy, everyone's healthy. And that's backed by science is key. So
we're getting the word out together. We're getting the word out. Nam, U equals U, Bruce, everyone, we will get the word out. And also, everyone who's watching this, find someone to tell who doesn't know already, because that's how we do it. Shag one, nag one. Bruce, it's always great to have you on the show. It's really lovely to see you again. Thank you so much.
Thank you so much, Bruce.
Happy anniversary, happy birthday, Gus, and thanks for having me and all that you do for U equals U.
Wonderful.
Okay.
Thank you. See you soon. Bye.
So,
La, I've just noticed your necklace. Gorgeous.
Yeah.
So, Susan, you've actually got a longer history of NAM than I do. What does your history of NAM mean to you?
Oh my goodness. Well, actually, I have worked for NAM twice, initially over 20 years ago. But actually, NAM has been incredibly important to me as someone living with HIV. I was diagnosed through a routine immigration test in America, and I just got married to my second ex-husband. I've had so many ex-husbands, it's hard to keep track. And it just didn't cross my mind for a moment that it would my results would come back as positive. But the doctor said this was just over 20 years ago when there was effective treatment. But the doctor said to me, well, the good news is you don't have syphilis, but the bad news is you're HIV positive and you have about 7 years to live. So you can imagine the impact that had on me, particularly the fact that my children were very young at the time, and I didn't think that I would live to see them grow up. However, even though I was living in America, my mum in England actually took out a subscription to NAM's AIDS treatment update and would post them over to me in Louisiana. And I realized that the doctor was wrong, that I could expect to have a normal life expectancy, and information has been incredibly important to me from NAM. So for instance, when I had children, finding out about the medication I couldn't be on, and also things like when I had cancer and I needed to change my treatment, NAM was there for me with information. So hugely important. So even though I was a child when NAM started 35 years ago, very much celebrating the birthday today.
Yeah, I mean, I often feel just how incredibly privileged I am to work for NAM. And I say that because sometimes I will be in a situation and I will tell people where I work and they will say, oh, NAM saved my life. And how amazing is that?
Yes.
It's just amazing.
Go now.
Yeah.
Before
we get sentimental, let's get our next guest on.
Yes.
It's Mercy Shibemba. She is a lifelong HIV activist, and I'm really excited because she is now writing for NAM. So welcome, Mercy.
Hello, thank you so much for having me. It was great to hear your two little reflections on what NAM means to you. It is a really positive and influential thing that can't really be understated. So go NAM.
Yay! Thanks, Mercy. And Mercy, and today marks the start of Mental Health Awareness Week, and a study by Dr. Shima Tariq and colleagues found that women with HIV, particularly Black women with HIV, were more likely to experience mental health issues, but less likely to be offered support. What do you think is driving this?
So, as Matthew already mentioned, I'm one of NAM's emerging voices, and I actually wrote an article about this because I think it's really important. And the way in which I kind of approached the piece was looking at the consequences of structural racism. So, you know, in the study that the team conducted, they did that secondary analysis and noticed that a lot of the negative outcomes were impacting Black African and, you know, Black Caribbean women. And it is about, you know, structural racism and the lack of intersectionality in healthcare and having that holistic wraparound model. And so it wasn't just even poor mental health, it was about prevalence of poverty, social isolation, and then obviously that impacts on your mental health as well. And I think it's really important that we as a sector have more frequent and frank conversations about structural racism and the impacts of that on the lives of people living with HIV, but also the impacts of that on the way in which we set things up. So, you know, the organizations that we're running, the movement that we're building, how are we making sure that we're not leaving any room for white supremacy to continue to build harmful outcomes?
Hugely important, and I couldn't agree with you more.
I am so delighted that you're writing for us now, and I was just kind of thinking when we invited you to be on the show, I was like, oh my God, like, Mercy's been living with HIV for as long as I have. Yeah, which is kind of like daft.
Twins. Yeah.
I know, because I'm old enough to be a
year,
dad, or you know, even your granddad maybe. So, but I mean, and I guess it's also, I mean, because when NAM was initially founded, it was founded by volunteers at the Lesbian and Gay Switchboard because that was a source of HIV information. And then when people were ringing up, they were like, actually, we don't know anything more anyway. So they were like, we better make sure that we're giving the right answers. And they started doing the research and all of that. But it's one, I mean, so it's kind of gone from it being an organization which is about people who may have acquired HIV or may be at risk of acquiring HIV, usually as an adult. But obviously now we have a generation of people who were born who have a lifelong experience of HIV. How different do you think it is? Kind of, I mean, do you feel like kind of it's a very different thing, having a lifelong experience of HIV?
I think it is, for better and for worse in some circumstances. So for me, one of the things I talk about is stigma, and how for someone growing up with HIV, you have a multi-generational approach to stigma. So I don't carry just my own experiences of stigma to do with HIV and how I kind of navigate the world and what that looks like for me, but I also take on that of my caregivers. So, you know, when I speak to my parents, I have an understanding of, you know, how they experience stigma and the things that they saw at the time when, you know, I wasn't around. And so I often talk about that, those layers of complexity, that you're not just approaching this as a journey by yourself. And, you know, that can be a good thing because you're not necessarily as isolated as somebody who is, you know, they're the only person affected by this. But actually it means that growing up had to do a lot of, wait, is this my experience, or actually is that my parents' experience, and what are the generational differences in how we approach stigma, but also how we might experience it. And I think linked to that is the fact that it becomes a family issue. So one of the things that I really grappled with when I was thinking about, you know, being public about my status and sharing my story was that it wasn't just about me. Actually, the moment that I said I've been living with HIV all my life meant that my parents immediately were kind of outed. I hate that term, but in a sense, it shared a part of them too. And having to navigate, trying to be respectful of their story, but also owning my own story, my own status, and my own life with HIV has been a tricky balance. But then the final point I would make is we're in some ways probably prepared better because, you know, we've had that experience of pediatric care with HIV, which is a really nurturing and caring environment. And I think that, you know, I can't imagine being diagnosed in later life and not having yeah, just such a significant experience of growing up with HIV and really being wrapped in, you know, the care of the team around you and learning as you grow with them. I think that's something that's really important and something that is really different.
Yeah, no, absolutely. And you've done incredible work with other young people living with HIV. And we hear a lot about young people falling out of care for HIV. Yeah, where are we going wrong? What's happening here?
Yeah, I think we have to almost ask the question, are they falling out of care or are they being pushed out of care? I also wrote a piece on this for NAM, and it looked at a couple of different models of transition from child to adult care in, you know, several different countries. I think Spain, the UK, and the Netherlands. And one of the really big things was that actually the indicators of young people who, you know, don't engage with care later on in life can really be seen much earlier in childhood. And so my one thing with that is, if you've got a child in your care that, you know, these indicators are red flags that are showing up already and they're, you know, 10, 11 years old, you have time to do prep work, and you should be doing that prep work so that in 20, 30, 40 years time, they are able to have, you know, a relationship with, you know, healthcare professionals and engage in that. I think it's really important. And I think the other thing is about assumptions of autonomy and picking times to move people on when it's just not optimal. For a lot of young people, you move from child to adult care when you're doing, in the UK, your GCSEs or A levels, or moving to university. Why would you pick a time when someone's experiencing like the most amount of change they've ever had to say, okay, off you go, you know, into the big, crazy, wide world of adult care? And I think, yeah, for me, I really want to see more conversations happen, particularly in the UK, around how we're going to serve my age group, which is, you know, that 18 to 25 plus ish gap of people who are dropping out of care because it just doesn't speak to them.
Yeah, absolutely.
Really important stuff. Thank you so much, Mercy, for coming on. Really great to see you.
Thanks for having me.
Mercy.
And happy birthday to Nam.
Thank you.
So I mentioned earlier that well, when we were just talking with Mercy just then about how NAM was founded by volunteers at Lesbian and Gay Switchboard in London, and last time we moved offices, I came across the original National AIDS Manual, which is what NAM stands for. It was a ring-bound folder, and the volunteers would put pages in, and they would send them all around the country to other helplines, not just gay ones, but, you know, any helpline which might be dealing with any calls from people who are concerned about HIV or AIDS. And as you open it, it has a page, and it says this resource is dedicated to the memory of Martin. And I was looking at it and I was thinking how great it is that we can now treat HIV effectively. Obviously, back when NAM was founded, we weren't able to do that. And, you know, people often talked about an HIV diagnosis being a death sentence, and that language is problematic in and of itself. But then, because of the way we've changed as an organization, we are now very international. I know that we have people all around the world who are watching this broadcast right now. And I guess what strikes me, it isn't that memory of Martin is history. It's still ongoing. 690,000 people died of HIV-related illness in 2020, the last year for which we have figures. And I just think that this shames us. This shames us all. So I hope that one of the things that NAM does by talking about treatment and talking about the effectiveness of treatment is that we're really saying, get this medication into people's hands right now. Don't let there be any barriers, because no one should be dying of HIV anymore.
Yeah.
And I think why we celebrate anniversaries. We mark the passage of time because we want to see change. We want to see action happen.
Absolutely. Very important indeed.
Talking of action, let's get our final guest on.
Hello.
Hello.
Hello, Gus. Happy birthday, Gus.
Thank you. Yes.
Happy birthday. It's it's kind of odd actually having a staff member on the show of someone who's in our team, but I'll just tell the viewers, as a formality, Gus is retiring. It's his birthday, and he is retiring. And he wrote this resignation letter. I said, I need to have something for the records. And he, of course, being a brilliant writer, he wrote this thing which just made me cry because it was just so moving and so personal. And within that, he said, I never expected to retire because that's just not what people with HIV do. And here you are, you're retiring, and it sounds wrong, but I couldn't be happier because I think it just says so much about the progress we've made. And you actually you said also that actually it was information you got from NAM which discouraged you from taking AZT monotherapy.
Yeah, and a lot more information, but that was certainly one of them. I mean, I've had HIV for 38 of my 66 years, so kind of more than half my life. It's very interesting. In the Beaver conference, I stood up and asked a question about COVID vaccines because they were looking for people who'd had very low CD4 counts. They said, well, my lowest was 10, and there was almost this audible kind of 10 gasp went around the audience because people like me who only just squeaked through AIDS, I think, because none of us are getting any younger, and we're the oldest generation. But yeah, NAM, certainly I remember the very first issues of NAM appearing against Witchboard before, because I was still working there, but then I went off and worked with homeless kids in the West End for a while. But then I started getting HTU, literally dropping through my letterbox, and it was looking at those studies to help me make those decisions. And basically, all the studies on AZT monotherapy said, well, you can buy yourself a few months of life, and I knew this stuff already made me feel crap. So I thought I'd rather take my chances and try all sorts of alternative wonderful therapies, the sort of stuff I'd probably disapprove of these days, in order to get my few months of life, but make them happy ones. And so I did lots of sorts of drumming in the woods and shamanism and psychotherapy and Chinese herbs, and which was great because it was like having the Boy Scout holiday. Like having the Boy Scout holiday I never had when I was a kid because I never joined the Boy Scouts because I was a little wimp. But yeah, and so here I am. I mean, you were going to ask me what my sort of proudest achievement is. And I mean, I'm going to say things that are more specific, but one of my proudest achievements was simply surviving and still being here. Because you find yourself in a position where you are acting as a kind of witness to those years, and there's fewer and fewer of us around. I also had the experience of having my current boyfriend and my ex-boyfriend who saw me through the years of AIDS, both sitting at dinner together without arguing with me or each other. And I thought both of these men really loved me and both of them saw me through. So that's another proud achievement.
Wonderful.
But yeah, ask away what you were going to ask them.
Yeah, so Gus, you gave me my first opportunity about living with HIV when you were editor of Positive Nation, and I had a regular column, Sex in the Suburbs, and I even did a naked cover of Positive Nation when I was heavily pregnant to show that women with HIV can go on and have children. But how important would you say it is to have a diversity of voices in relation to HIV?
Oh, I mean, it's hugely important. So I mean, it's, I need to say I wasn't the first editor of Positive Nation. That was Graham McCarrow, but I was sort of asked to be the next one. And really, from the word go, I wanted alternative voices in there. We had the first Black African woman, Winnie Saruma, on the cover. You, as you mentioned, were, I think, the first Black woman with HIV to write a column. We had the first Black African man to write a column, Simon Wendapoli, late and much missed, beautiful guy. And I think it was, we really wanted, and I think it was partially to do with our philosophy in Positive Nation, which was that we didn't want it to be a magazine about HIV. We wanted it to be a magazine for people who happened to have HIV and had a lot of life in it, if you see what I mean. And that's kind of, that was our aim, really.
Wonderful.
I remember it wasn't the first time I met you, Gus, but it was an early time, and we actually were doing a radio show together. I was working for Game Fighting AIDS at the time.
You would bring
and literally just before we went on air, you disappeared, and I was like, "Oh my god, is it just going to be me?" I was like, "Yeah, it's just going to be me." And then you came back, and live on air, you said, "I'm sorry, I only just got back here in time. I just had to run to the toilet because my bowels were giving me hell thanks to the medication." Yeah. And I thought, God, he's doing this.
Certainly in those early days, you had to cultivate a kind of stoicism in adversity and a kind of shit-kicking kind of attitude that you know, you weren't going to spare people the details if by giving people the details they were going to treat you better. That doesn't mean I think that HIV should always be trumpeted from the rooftops. It's interesting because I've had my own issues in hospital recently. I had a dodgy gallbladder taken out, which was probably a legacy of AIDS, interestingly. And I was in this mixed ward with guys with awful things like, intestinal cancer and autoimmune hepatitis. And the surgeons, when they came in, would always talk about, "And your HIV," in sort of whispers. But I kind of understood that because it's still a powerful taboo, and I think it behoves people like us to be public about HIV, but at the same time, it also behoves us to understand why this disease still casts the spell it does, more so than COVID.
Absolutely.
Yeah.
Gus, it's been fantastic to have you on the show. We've run out of time already.
Oh, what a shame.
Thank you so much,
Happy
Gus.
birthday.
Enjoy the rest of your birthday.
All right. Okay. Bye-bye.
Bye. Oh my goodness, we're out of time already. I'd like to say a huge thank you to all of our guests who have been absolutely fantastic.
And to our sponsors, Theratech and Wandsworth Oasis.
And to Disruptive Live, who just make all of this technical wizardry happen.
We will be back in 2 weeks' time, which makes it the 23rd of this month. And look forward to seeing you then.
See you then. Bye and happy birthday, Nam.